So, good evening everyone. Today we'll learn something about acute rheumatic fever. So, if you've seen our previous session, it was on the heart failure. Hope you understood the class on heart failure. So, today we'll be dealing with acute rheumatic fever. When you hear the word acute rheumatic fever, what do you mean? Acute is something which is severe and sudden in onset, whereas rheumatic is something where it affects the joint. And rheumatic fever is concerned with the infection or the inflammation of the heart, okay, or involvement of heart. Coming to the definition as proper, it is an inflammatory disease caused by group A streptococci. So it is one of the sequelae or the infection sequelae of a group A streptococci. Okay, it's an inflammatory disease. So now coming to where and all you see your acute rheumatic fever. Basically, it is seen in the cardiac muscle, that is heart, joints, skin, nervous system, and subcutaneous tissue. As you know, this group A streptococci is going to affect these areas, and it's very prominently. It's very prominent. It's going to affect all these heart muscles, joints, skin, nervous system. Why? The reason is because the antigen of the streptococci is the structure of the streptococci and this area is similar. Okay, that is the reason you will find the effect on these kind of on these sides. So let's understand more in detail. If it is similar, what happens? Okay, the pathogenesis of your acute rheumatic fever. So when any infection in your body, what happens? There is a release of your antibody, right? And whenever an antibody is released, this antibody is going to destroy the pathogen which is causing infection. Okay, but in acute rheumatic fever, there's a big twist. That is, the pathogen structure of streptococci A, group A streptococci, is similar to the structure of streptococci is similar to that micro level structure seen in your heart. Okay. The heart muscles has a structure. Okay, there's a structure of your heart muscles. It's a very micro level. It is also called as micromimicry. The word is also called as micromimicry. Okay, micromimicry. Because in the micro level, in the microstructural level, the pathogenic structure and the structure in your heart muscle is similar. So whenever this antibody is released, this antibody is going to destroy the pathogen as well as it destroys that heart muscle layer also. So thereby causing your various sequelae of diseases. Okay. So let's go in detail on what happens if a disease is caused. Let's learn about the clinical features. So before going to clinical feature, let's see, this prevalence is more seen in your Western Europe and in the poor economic state countries. Okay, it's in very low economic state in Western Europe. Clinical feature. What happens? Initial symptoms. Any streptococcal infection, any bacterial infection, you see a fever, you are kind of lethargic, anorexia and arthralgia. It's a very common thing you see in every bacterial infection, but the distribution factor or the most important factor is your clinical feature is based on your John's criteria. Okay, there is a John's criteria which divides and which is very helpful in diagnosing your acute rheumatic fever. In major criteria, you have something called as carditis, polyarthritis, and rheumatic chorea. Along with these are 5. Okay, remember this 5. That is carditis, polyarthritis, rheumatic chorea, erythema marginatum, and subcutaneous involvement. Okay, these 5 are the very major factor. Means why is it major? Because whenever you see any symptoms from these line, then it is surely going to be a very important characteristic feature of rheumatic fever. But whenever you see anything like fever, arthritis, previous history of rheumatic fever, raised ESR or prolonged prayer interval, all these are very common and can be seen in many other diseases. This is a very overlapping thing, okay? But this will be a very important or a major characteristic of the major characteristic in helping in diagnosis of rheumatic fever. So how do you diagnose? There is a based on there's two major. It should be two major. Any of the two major criteria, along with one minor criteria, or there should be any two minor criteria to satisfy your diagnosis of acute rheumatic fever. Let's go in detail about the each one, like what happens in carditis. Okay, so in carditis, you see it's a most common manifestation present with dyspneas, means unable to breathe, and there is a chest pain. You see cardiac enlargement because these antibodies are directed towards your heart muscles, right? This is going to disturb the whole process there. Like there is a tachycardia scene, there's a pain scene, and there is a very characteristic environment is a caricom murmur, which is usually seen in your carditis, okay? And leading to aortic regurgitation. These are bound to happen whenever there is a cardiac enlargement or any tachycardias. This is very bound to happen. So now coming to rheumatic chorea. What happens in rheumatic chorea? It is a kind of, it is a plunging, dancing, irregular movement of your extremities. Your extremities, you are unable to control the movements of your extremities. That is your, it indicates CNS involvement, because the in the CNS there is a part which will help in our locomotory actions, okay, or any actions that is disturbed by this, that is disturbed by your that is disturbed in acute rheumatic fever. Arthritis, migrate normal, you see, because it involves a joint. So there is a very famous saying where this rheumatic fever is going to lick your joints and cause a lot of problem to your heart. Okay. The fever throat. Okay. Erythema marginatum, it is indicating the involvement of skin. So it starts as a red macule. So now you know it's a skin disorder. Erythema multiforme is skin. Arthritis involving your limbs, TMG, and periauricular tissue along with your joints. So it is very important. Rheumatic fever is going to lick your joints. That is very, very important. You should remember. Rheumatic chorea, CNS involvement, carditis is very tachycardia and cardiac enlargement is seen. Now, how do you investigate these disorders? Like, what are the tests you run to confirm your diagnosis? So, first thing is a blood examination. If you see there is a leukocytosis, raised ESR, very common, reactive C protein. Whereas bacteriologically, you see you take a throat swab culture and you see there is a group A streptococci positive. Okay, and there is a raise in the streptolysin antibodies in your body. So that is very simple. Just X-ray you do, and you see chest X-ray, you see cardiomegaly, and ECG if you take, there is a clear evidence of AV block. So these are all the investigative features which you'll run to find out the diagnosis. Coming to the last part of the rheumatic fever, that's the treatment. What are the treatment modalities you will perform to curb this infection? So first thing is a bed rest until temperature. So any fever that is very common, you have to take a bed rest. Good bed rest is a main important feature until the temperature comes down. Salicylates, that is aspirin, is given into 6 doses against arthritis. For arthritis, you give aspirin. Corticosteroids, that is prednisolone, is given to help in because you have carditis there. Okay, there's inflammation of your heart and there's a lot of pain. So to curb all those, you give prednisolone, antibiotics against your own streptococci, because the streptococci infection is going on there. You have to give antibiotics such as benzathine, penicillin, IM by once a week for 3 weeks. Okay, prophylaxis are preferred, and these has to be taken. And this acute rheumatic fever, very important is understood that it's seen commonly in your children, like young age and adolescents. Okay, so they have to take their medication until 5 years, and prophylaxis is must in the case where you suspect streptococcal infection. and the more susceptible to these diseases like rheumatic diseases, you will know you will have a streptococcal infection at prior, and that would have not resolved, so you know it, so you will be having a prophylaxis, that is erythromycin or sulfonamide are given to curb this rheumatic fever. Okay, I hope you understood. If there's any doubt, you can post in the comment section or you can just contact me. Thank you.